He's only just received his ballot paper, but Vasily Crispy has already decided he'll be voting to strike with other junior doctors. He says things can't go on as they are.
Within an A&E department to have 150 patients waiting to be seen, it is heartbreaking. It's a very difficult situation to find ourselves in. There is no privacy, there is no dignity to patients who are either lying on the floor, sat on a chair or lying on a trolley. This is not the way we want to practice medicine.
He says strikes are the last resort.
We must take industrial action if we want to save our profession, if we want to increase our pay and improve our working conditions, but most importantly, if we want to be able to save the NHS and care for our patients.
From here in West Yorkshire to Shropshire, where Simon Day works as a paramedic, staff describe a health service in crisis.
An average day will involve some amount of delay at hospital when you convey a patient. And a good day would be an hour or maybe 2 hours. Bad days become when you spend your entire shift with one patient outside that hospital.
Simon will join a picket line again tomorrow. But as the government introduced plans for new laws to limit industrial action, unions reacted angrily to comments about the last ambulance strike.
Employers could not reach agreement nationally for minimum safety levels during recent strikes, and health officials were left guessing at the likely minimum coverage, making contingency planning almost impossible and putting everyone's constituents' lives at risk.
His words described by one union as an attack on ambulance workers. And more strikes seem likely as the government continues to refuse to talk about pay for this year. The number of staff in the NHS has increased in recent years, and yet the government say that's not translating to outcomes. Could you and your colleagues deliver any more than you do currently?
No, we can't. Whether it's paramedics, nurses or doctors, we do not have the capacity or the strength to continue working at the standards that we're working at the moment.
And that's why, as the Health Secretary visited workers at a 111 centre, the rift between government and unions was looking increasingly difficult to heal. Becky Johnson, Sky News, Leeds.